You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, new treatment options for people that have been diagnosed with gum disease, periodontal disease. With us, we have an expert on the topic, Dr. Duane Keller. Dr. Keller, welcome to the program.
Thank you, Randy. It's a pleasure being here.
Now, before we get into today's topic, I have a lot of questions. What defines gum disease? I mean, what are the symptoms?
Well, Randy, gum disease is an infection.
Okay.
And when you have it, what you have is the gum disease begins to make the gums get a little bit puffy. They swell a little bit. Right. If you brush or floss, you may get a little bleeding.
Isn't bleeding regular? I mean, a little bit of bleeding is okay?
No, bleeding's not okay.
Okay.
Bleeding is a sign that you've got ulcerated gum tissue. There's a sore under the gum tissue. And then if it gets bad enough, the gum tissue will begin to recede and the teeth begin to look a little bit longer. And if it continues, you begin to lose the bone, then your teeth start to get loose. And that's why most people end up losing their teeth if the disease gets too bad as it proceeds.
Help me understand the connection between bad breath and gum disease.
Well, Randy, one of the reasons that people can have bad breath is because they can have an infection under the gum tissue. Okay. And those bacteria can be responsible for causing part of the reason for the bad breath itself. And if we can control those bacteria, we can get rid of the bad breath.
So at the top of the show, we talked about new breakthroughs in the treatment of gum disease, with bleeding gums, bad breath, right, puffy gums, loose teeth. What are the treatment options?
Well, one of the options, Randy, has always been to remove the infected gum tissue. A small incision is made, the gum tissue is moved back, cut out all the infected gum tissue, scrape off all the remains that are there, the calculus and the tartar, and then suture that back up. And that's been good, Randy, because it's actually been a way to get rid of the infection.
So it's cutting it out in a way?
It's actually cutting out the disease.
Is that like the #1 way major gum disease or severe gum disease is taken care of? That
is the way most of the specialists have treated gum disease. Another way that we have begun to treat gum disease is by using a laser. And the periodontists who are using the laser in place of the surgery that they used to do love it.
Okay.
Because what they find is it's not as painful to the patient and the healing is a little bit quicker. But we've got the same problem. The bacteria that remain have a tendency to regrow. So the periodontists, the dentists, and their hygienists are now faced with the complicating factor of how do we keep this under control after we've cleaned it up in the first place? Send the patients home with the same home care? Guess what? The problem starts to come right back.
So you're the owner, and we haven't really mentioned, but you're the founder of the Perio Protect Method.
Right.
Okay, which works in combination with these other therapies, if I have you right.
Absolutely.
Is that right? Okay. So I guess knowing all of this, that it keeps coming back, what, you just decide, I'm going to come up with
I wish it was that easy, Randy.
Okay.
What actually happened was I did a section of surgery for my mom who had gum disease. And at that time, that was the only way to treat it. And we got good results from what we were doing conventionally. We made an incision, reflected the gum tissue, took out all the infections, sutured it all up, and we got decent results. And I said, okay, Mom, it's time for surgery #2. And she looked at me with her beautiful little blue eyes and goes, son, it's not going to happen. You got to find another way.
Okay.
My teeth are too long. I get food caught between them. Everything that is cold bothers my teeth now. I can't get the food out from between my teeth. Find a different way. And that's how it started.
And by the way, I want to cut in because anticipating this interview, I've talked to other periodontists, and they say that's the story of our life. Do one section of the mouth, can't get them back for the other section. So your mother's like everyone.
My mom's like everybody. She said that what she would rather do is have me take all of her teeth out and give her dentures. And I wasn't going to do that for my mom. So that's why I looked around and began to experiment, and we eventually have developed this Perio Protect method that in combination with your scaling, in combination with lasers or whatever surgery is necessary, or whatever home care that you're using, this now allows you to deliver medication up under the gum tissue and hold it there long enough, and the medication then actually kills the bacteria that cause the disease.
How are you using it in your practice? I mean, give me some stories of people that...
Best example I can give you. I had seen this patient for years, and he came in actually on his 90th birthday, and he was just as grumpy as he could be. It looked like, He just lost the dog, got run over by the mailman or something. He just looked terrible. And I said, what's the problem? And he said, well, you know, I'm 90. I can't stand, I can't floss, I can't brush anymore. I've got puffy, bleeding gums. My breath is really bad. I just want you to take my teeth out and put in dentures. But when I looked in his mouth, Randy, yes, his gums were a little bit puffy, a little bit bleeding. And anywhere that we would explore, there'd be some bleeding. But they weren't severe enough that he was going to lose his teeth or had to lose his teeth.
Okay.
And I thought there'd be a better way to help him turn this around. So what I talked to him about, for less than it would have cost him to have all of his teeth removed and put in a set of dentures, we could make these trays, Randy, and we could then deliver medication up under the gum tissue.
That would kill the bacteria that's causing all these problems.
Correct.
Okay. It's all done. What does this guy say? 90 years old, comes in, he wants all his teeth taken out.
You know, I've got pictures of him afterwards, Randy, and it's an entirely different human being. He's back smiling, the jovial person I've known all along.
Good.
Except there's one complicating factor. 90-year-olds, when they sit down, because he would wear his trays at night when he'd watch TV, well, you fall asleep sometimes. So he'd wear his trays longer than we ask him to, and he bleached his teeth piano key white.
Is that right?
Which was okay because he was looking younger, but his younger wife wasn't real happy because now he had whiter teeth than hers. So she comes in to get a set of trays, not to control her gum disease, but because she wants whiter teeth like her husband.
Good, good, good. Now, you know, another thing, you know, I had to check you out. I spoke to a dentist in Arizona, and I said, is this guy Dr. Keller for real? True story. And I told you this. And I said, does this device, these you know, medical trays, do they work? And he goes, Randy, not only do they work, he goes, I own a laser. It's like a $100,000 laser. Right. And by the way, I should mention, I'm not trying to endorse you, and we're talking about gum disease here, but this is a story. Dr. Wilson told me, and he goes, Randy, in 50 or 60% of the time, I don't even have to do the laser. I don't have to do surgery on these people. It's reversing the bleeding gums, the puffy gums, the bad breath, and those things. Now, is his story unique?
We've got between 4,000 and 5,000 dentists across the United States, and they're all getting similar results, which is they now are seeing less bleeding gums, the swelling goes down, the bad breath goes down, and the health returns. So what we're dealing with is a real way to help the patients control their health.
Tell me what some periodontists, and we should mention, over 4,000 dentists are using this tray, this medical device, okay? And let's just talk about the gum specialists for a second, the guys that are dealing with gum disease, the periodontists. What are they saying to you? I mean, what do they say? I mean, what do they like most about it?
We had a periodontist who was actually teaching periodontics at one of the schools.
Okay.
And he began to evaluate this in his office. He puts them on perio trays before he does anything else. Now, he still does the other surgeries, the other aspects of it, but what he has found is he now has a way that he can give the patients a method that will help maintain his gains, that they can control the cause of disease with the medicine that's delivered by those trays. We had a patient in who'd actually been referred to one of the periodontists in our town. She had swollen gums, bleeding gums, bad breath, gum tissue starting to pull back.
Okay.
She's been told that she has to have surgery. What we do is we use these trays to deliver the medication, and guess what? All of a sudden, the swollen gums are gone. The bleeding's gone. Those pockets where the infection was, they're all gone. They're all 1 to 2 millimeters. And we see her 2 years later, there's no sign or symptoms of disease. There's no bleeding gum. There's no pocket beyond 2 to 3 millimeters. There's no swollen gum tissue. She's got much fresher breath. The only problem is her teeth are whiter.
Yeah, so that's a side effect with this tray. Could you show me this tray? So you use them yourself, and by the way, your teeth are fantastic.
Well, thank you.
You have no gum disease, by the way?
I have no pockets past 2 millimeters.
Okay, so for people just tuning in, we're talking about gum disease, and there's many treatment options. This is one of the newest treatment options to kill the bacteria of gum disease. So we're going to take a quick break. We come back, more questions about how it fits in the mouth. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back.
The clinical results with the Perio Protect method were remarkable. What we noticed right away was that patients that had continued problems with their periodontal condition started to clear up. And we started to have success with patients that at one point we thought were hopeless. They were now treatable.
With Perio Protect trays, what I hear after the patients used for about a month or so, I always hear that they feel better, that the gums feel tighter, they don't have the bleeding they had before, they don't have the itchy sensitivity they had before, and they just feel better in their mouth.
I've been on for 10 weeks. I went to him and started my trays the end of January, and when I went back to see him the end of February, in 5 weeks' time, my gum disease was gone. I went from bleeding and various numbers that they project on theirs, and I had none anywhere in my mouth. My gum disease was gone in 5 weeks.
The Perio trays are easy to use, they're effective, and your mouth just feels clean after you use it. And if you use it daily, it means your mouth feels better every day.
Things that I've done in the past have been a great deal more invasive, a great deal more painful, more in the office visits with a dentist, more money being paid. But with the Perio Protect trays, I get to take care of myself at home. Sometimes even at work, I'll stick them in for a while during lunchtime or something if I don't have anyone coming into the office. So it's more of self-maintenance. It's painless, it's easy, so it's totally different than some of the past practices I've been subjected to.
It's designed in two ways, for gingivitis and periodontitis. And for patients who only have gingivitis and they have the minimal bleeding on the posterior teeth, it's always a good way to let them use those Perio Protect trays to stop the bleeding and prevent them from developing into periodontitis.
I immediately noticed a difference in just how my teeth felt. Every morning I use my trays and I feel like I had my teeth professionally cleaned every day. And just throughout the day I feel like my mouth is cleaner. That sounds silly, but I notice a huge difference. I feel great. I'm glad I use them every day.
It does kind of whiten your teeth, and my gums are healthier, redder looking, and they're not receding anymore.
And there's a link between gum disease and all sort of health problems, and research showed that now. We know better now that we don't just take care of the mouth, we take care of the whole body by taking care of the periodontal disease.
Within a few weeks of using the medicine, I stopped having bleeding gums. My breath was fresher. I could tell that. I felt like my mouth was just cleaner.
I would recommend this to other people because it's a wonderful program. You have control over how often or not often you don't do it, but the more you do it, the quicker the process is. It's very easy to use, and it absolutely works, and I just can't imagine anyone not having good results from it.
You're watching the Wellness Herald, leader in medical news and information. I'm Randy Alvarez. We're talking about gum disease today. No more gum disease, possibly. With us, we have Dr. Keller. Dr. Keller, welcome back to the program. So how does it work?
What we're looking at is it's a tray that's made specifically to fit me in accordance to whatever my conditions are. All you have to do, this is like putting toothpaste on a toothbrush. This is simple. This is not difficult.
You do this every day?
I do it twice a day.
Okay.
Put the medicine in. That's how hard it is.
And how long? So for people that just have light gum disease, bleeding gums, early onset, how long do they have to wear these? A day?
About 10 minutes. And it's hard to say 10 minutes with these trays.
All right. So 5 minutes in the morning, because we've talked on the phone.
10 minutes at a time.
Oh, 10 minutes at a time.
Right.
Now tell me about the science that's behind this. So it's that easy. It's obviously pretty easy.
It's easy to take them in,
You do
take
yours
them
in the
out.
shower, you say? Watching TV, whatever?
What I do is I wear mine in the morning when I shower. What I do is turn the water on. While the water's getting warm, put the medicine in the trays. It's easy to do. You saw how hard it was. Put the trays in. While I'm showering, I'm also killing bacteria around my teeth.
Is this life-changing, you know, for some of your patients?
Oh, Randy.
I mean, in your own private practice.
One of the fun parts of the practice is listening to the patients and hear how it's changed their life.
Okay.
Because they no longer have to worry about bad breath. They're much more self-assured about who they are because they're no longer having to worry about being offensive. They don't have the swollen gum tissue anymore. They don't have the bleeding anymore.
So they have a beautiful smile.
And they've got a beautiful smile because it whitens their teeth as one of the side effects.
But you say they smile more. Why is that?
Well, because they're not so self-conscious about it.
Okay, okay.
They don't have the infection anymore. And I think they feel better because that's what they tell me.
So we're just about out of time, but I want to establish one thing, that if somehow there's a way, and I want to know if any expert would disagree with this, if you kill the infection, this periodontal disease under the gum line, people wouldn't lose their teeth. That means they wouldn't fall out. Is that true?
I think, Randy, there wouldn't be a single expert in the world that would disagree that if you could control the bacteria and stop the cause of disease, that you should be able to keep your teeth for your lifetime. That's what we've been looking for.
Okay.
And that's what we're able now to start to do.
I had a rheumatologist in my on my set about an hour ago, and she was here saying, you know, if they have an infection anywhere in their body, there's an immune response.
Correct.
Do you feel the same way, that when you get rid of this, their body works better?
We see, and we've actually have the research that's been published to show that when people get rid of their gum disease, their systemic infections also decrease.
Okay. So if there's an infection anywhere in the body, there's going to be a problem.
Absolutely.
And so if it's under the gum line, if you could kill it, whether through a laser, through cutting it out, people are healthier. Is that right?
If you can get rid of any disease, then the body is healthier because it's not having to fight that disease.
We're going to take a quick break. When we come back, I want to know the process of getting fitted and also the cost of these medications that you're using. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back.
Pockets that I had experienced, which were about 5, maybe 4 in depth. I had a lot of 4s and 5s actually, had been decreased to 1s and 2s in just 3 weeks' time, and I had no more bleeding at all.
In addition to having cleaner teeth, fresher breath, my gums don't bleed as easily, and brushing my teeth, everything is more comfortable. It's great.
I'm using it about 3 months, and the most important thing I would mention, I feel healthier. Anytime you touch your face and you touch your gums, it's just, you know, a little bit of pain here, a little bit of pain before, and it's no pain, virtually no pain, and you see the gums are healthier.
Seems that the product will actually make everybody shrink and heal within just days of times that they begin to use. Once we start a patient with a Perio Protect system, whether it's a new patient who has never seen us and never been under our care, or one of our older chronic patients, the gums almost immediately shrink and start reducing pocket depths, turn a lighter color pink, and normally bleeding's gone in a week to 10 days.
I was a little skeptical. I come from a family who has dentists in them, so they have their way of doing things, and this is how we'd always done it. So I wasn't sure what it was about. But from what I was told, it was definitely worth an investigation and an appointment to come see. And once I started, I understood completely, and it just worked so well for me that I had no more misgivings about it whatsoever.
I'm really pleased and just so excited that my gums can be healthy and I don't have to have false teeth, and I am now getting braces, as you can probably see.
I truly believe in the product, for one, because like I said, I use it, but also I have seen it with some patients that have so much bleeding and inflammation, and the next thing you know, they don't have it. If they use it, it'll work.
The best thing I can say about this, you're not going to have bleeding gums, you're not going to have pain in the morning, in the daytime or evening time, and you can eat any kind of food, any kind of acidity, you can drink any juice or any alcoholic beverages. If you use the trays, it's going to take care of your gums.
It's so easy to use. You just fix the tray and put it in your mouth and watch the news. It's quite painless and gives my husband a few minutes of quiet time, he says. So he doesn't mind that a bit. But it is just a very easy system to use, and works. That's the main thing, it works.
I really feel good about smiling again. My mouth feels real good. It feels good to me. I brushed more than I used to, but since she did that thorough cleaning on my mouth and then using the Perio Protective trays, I just feel like my mouth is a lot cleaner. It is cleaner.
But it's also what it does for me emotionally. For one thing, I feel better about myself, but I also have, my breath is fresher.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, gum disease, new treatment option that is helping to kill this infection under the gum line. With us, we have Dr. Keller, founder of Perio Protect Method. Did I get that right?
That's correct.
That was a lot to say. So you're the founder of the company.
Yes, sir.
4,000 plus dentists are using this in their office. They have to go through specialized training.
Correct.
Tell me about that.
Well, one of the things is we offer courses so dentists can begin to learn to incorporate this into what they're doing already so that they can just add this as the sort of missing link, Randy, of being able now to control the bacteria with the medications by delivering medications under the gum tissue into the infected tissue. So we walk them through the scenario so that everybody should be able to use the method in a similar manner.
Okay, and in some cases, we should mention, some patients have avoided laser, avoided surgery, and the trays did it alone. Do you hear stories from dentists every day that are similar to the guy in Phoenix, as you say?
We hear it every day.
Okay.
When doctors call in or telling us that, yes, they're all skeptical when they first start, and they have to be because this is something new. But we hear repeatedly, the infection's gone, the inflammation's gone, the swelling's gone. Best is the patients comply with it because it's so easy.
And this is their words, by the way.
This is what they're telling us.
When they say the infection is gone, I guess we have to be careful with that. But I mean, their symptoms are going away. Bleeding gums, puffy gums.
Right. What the doctors tell us who call us is that the inflamed gum tissue, the swelling, the bleeding gum tissue isn't there anymore. The nice thing is the patients enjoy using this because they like the clean feel that they get. It's like they just had their teeth cleaned by the hygienist. So they all love it.
And it makes your teeth whiter too.
It is one of the side effects. You will whiten teeth.
Okay, so what's the future with your company? I mean, it's in 4,000 dentists. I mean, your company has taken off. Is that right?
Our company, even in this time of economic depressed times, has continued to grow because we continue to have word of mouth from the doctors. We continue to have word of mouth from the patients that this works, that they've been able to get good results with it. So yeah, we're looking to try now and take this to the people as well as to take it to all the dentists in the United States so that they can all offer this as an opportunity.
Now, one of my guys that I had on the show, he said, he was very frank or blunt about it. He said, Randy, if they have bleeding gums, if they have puffy red gums, these people are headed for disaster. They're going to lose their teeth unless they get rid of that infection.
Right.
Do you share the same?
If you leave the disease there, the ultimate result of the disease is you're going to lose the support for your teeth and possibly lose your teeth. What we have to do is we have to address that infection by addressing what caused that infection. And the way you address that is by delivering a medication that can control those bacteria.
And the medication we're talking about, I mean, it could be a variety of medication, but it's a very natural, something that's used in hydrogen peroxide.
Right. Hydrogen peroxide is one of the oldest medications we've used in medicine to treat infections and disease. What we're able to do now is to deliver it and hold it long enough for it to be able to affect the bacteria.
Can people, for those that want to avoid antibiotics, have you had those cases where they've avoided antibiotics with this?
We have patients that this is all they use, just hydrogen peroxide. There's no antibiotics with it, so they don't have to worry about resistant bacteria. They don't have to worry about the side effects of the medication.
What about tetracycline? Somebody told me. I bet he's putting tetracycline in there.
Tetracycline can be used. You can use any medication.
But do you use it in your practice?
We do, sure. But we use it differently. We don't use it as an antibiotic. We use tetracycline as an antioxidant so that it can help control bone loss.
Okay.
So that we can help stop the bone loss for the patients.
But for those people that are even afraid of that stuff, they could do it naturally with just the gel alone and you could get it under control?
Right.
Okay.
This is what kills the bacteria, Randy.
Okay.
Hydrogen peroxide.
And the critics can't disagree with what you just said.
It's been around since almost time immemorial. It's one of the first antimicrobials that we have used. Heck, it is the antimicrobial. We make hydrogen peroxide in our own body. We make hydrogen peroxide in our white blood cells, of which you've got 1 to 2 trillion of them. We're going to make about 6.5 grams of hydrogen peroxide in our liver each day. There's myeloperoxidase, there's peroxidases in the body itself. Okay. There's lactose peroxidase.
So it's safe. So this is safe.
It is as safe as
Could
you
my
can get.
scientist buddy say, but Randy, the problem with that is this bacteria is going to figure it out, morph, and that'll be resistant?
No bacteria is resistant to an oxidation reduction reaction, which is a fancy term for what hydrogen peroxide does when it breaks down. It's the oxygen in here that's the agent that helps control the bacteria.
Okay, good. Okay, so somebody watching this, if they have bleeding gums, if they've been told they have gum disease, if they've been told they need surgery, they should look into this.
Absolutely.
Go to the website, and the website is?
www.perioprotect.com.
And if they live in your area, they could go directly to you.
They can go to my office.
All right, well, thank you for coming on the show. Great stuff. Great info.
Thank you, Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com and just put in gum disease or treatment options for gum disease, and you'll find it there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.